Mm.
Welcome to a standalone episode of our Talking Nachos. My name is Dr. Paul Goodman, Dr. Nacho. You're going to meet our guest here in just a second, where we strive to bring you new things happening in the world of dentistry, help you think about things in a different way. And I am happy to have our guest on today. I always let my guests just kind of introduce themselves and tell our audience what you do on a daily basis to help dentists.
Awesome. Well, thank you so much for having me on. I really appreciate it. My name is Dr. Michelle Jorgensen, and I am what I call a health-based dentist, which people might not know what that means because I made it up.
I
So
like that.
what it is it's what people often will term holistic or biologic, but I don't like either of those names. And I help patients be able to return to health through their mouth. And then I teach dentists how to incorporate these kind of procedures into their practice.
Awesome. And you were telling me a little before we got on, what inspired you, or, what was this moment where you said, hey, I'm going to make a change in focusing more on this, learning more about this in your career or your life?
Yeah, I didn't actually think any of those things. I got really sick and I didn't know what it was, started going to all these doctor visits. Nobody had any answers. And I actually had my practice for sale. And at
Wow.
this point, I had 4 little kids. The practice was the sole source of income for our entire family. My husband worked for the practice too. We didn't know what we were going to do, but I literally couldn't even hold an instrument anymore. My hands were so numb,
Wow.
so painful. And eventually, through searching, found that it was mercury poisoning,
Wow.
got tested, was off the charts. And the doctor said, if you're going to get better, you can't breathe it in anymore. And I didn't know if that was possible. Like, I didn't know if I could remove an amalgam filling and not breathe it
Yeah.
in. Found out it was. There were organizations that did this. I had never heard of them. I mean, most of you probably have never heard of them either. I had never heard of them. I didn't know they existed, started doing it differently. And that's when the practice started changing. And all of a sudden, patients started asking for change. Doctors started reaching out saying, hey, do you do this? And do you do this? And I had no clue what they were talking about. So I have to go and learn and bring that into practice. And it's completely changed my practice now. It's grown exponentially because of these changes. And it was all very unintentional, very organic.
I appreciate sharing this story. And now tell me this, and I'll play the role of some different dentists that I've seen on social media. Prior to this happening, I'll use a term my grandfather used to use. He would say, all this stuff with amalgam and poisoning, it's malarkey. It's made up.
Yep.
I'm assuming you probably, maybe you weren't voicing that, with your words, but maybe you prior to this said, I've heard people say this and it can't be true. Tell us kind of how you thought about this, right? Because there's a lot of dentists who say, this is made up, this is not true. I know you went through this personally, but tell us a little more deep in their understanding for the dentist who's saying, all right, I'm going to turn this off because this is all malarkey. Say, don't turn it off just yet. Tell us more about that.
I was them. I was exactly in that same position. The entire Mercury talk in dental school, and we all had it. But I've been a dentist for over 25 years, so I mean, I was an older talk. But the entire talk was that mercury is completely inert and stable once in a filling, and you don't have to worry about it. And if you tell somebody that it could be affecting their health, you will lose your license.
Wow.
Right? That was
Yeah.
it. Like, that was all we were told, is exactly what I just said right there. So if that's the case, then mercury wasn't even on my radar.
Yeah.
I mean, I went to every doctor. I was having MRIs and tests. I was visiting the chiropractor like 3 times a week, massage twice a week. I mean, it was ridiculous what I was trying to do to literally keep myself functioning. I never had it on my radar. And I was actually looking into coaching and consulting because I thought, well, at least I can use some dental,
Yeah.
what I've put into my profession here is my next career. And when I was talking with someone about teaching patients about nutrition, because I'd changed my whole diet trying to fix myself, I thought, well, maybe I can like teach people about this.
Yeah.
He had some of these things in his practice, and he said, you sound so much like me. Have you tested for mercury? Like, you've tested for it, right? I said, well, what are you talking about? Like,
Yeah.
mercury's not a problem. There's nothing wrong with mercury. Mercury's totally safe. And he
Right.
said, just get tested. Just go see. And I mean, I had nothing to lose at that point. What did I have to lose? Nothing, because I was losing everything. So I went and got tested, and mercury off the charts. So the doctor was like, whoa, how are you like functioning? I said, well, I'm not. I'm not functioning.
And I want to interject. I always tell people I don't interrupt. I just interject with brilliant ideas. That's what my wife said.
Perfect.
Don't ask her, just to take my word for it. My school maybe did a teensy better job, because I remember
Well,
a
that's
test
good.
question. I remember a test question, not a much better job. So Mad Hatter's disease was from
Yep.
mercury poisoning from the
Yep.
guy Alice in Wonderland. The Mad Hatter, who was the shoe guy, he had mercury poison that made him mad. And I just remember circling, because I'm old enough to circle still, on a test question that had
Exactly.
Hatter's disease was the mercury toxicity. And I remember this well from my dad and his partner, because I work with them, and they had carpets, and they said, so now I love this, you sharing this. Tell us about, helping you first, right? So you do this, but then you're going to go back to practice and you still have to remove amalgams. So what are you doing now to, whether it's protecting yourself, whether it's protecting the patient, whether it's protecting the team, protecting everybody? Walk us through. Someone comes into your practice tomorrow and you're going to remove amalgam. What happens?
Well, the interesting thing is it was all about me to begin with, right? It wasn't about my patient. It wasn't about anybody else.
Yeah.
It was simply about me and survival. Can I stay in this career? And so I found this organization called the IAOMT, and I didn't get on board with everything they were teaching and talking about, but they had a protocol that was already in place for how to remove mercury without breathing in a whole bunch of it. I mean, think about it. Like, you're removing the filling, their head's here, your head's here.
Right.
Where's
Yeah.
the vapors going to go? They're going to go up. That's what vapors
Yeah.
do. They go up. So they're going up right into your head. So I learned that some of the things we were already doing, rubber dams, or isolites, or, something that was like suctioning and keeping it out of their mouth, obviously, and isolating it. Lots of vacuum, high vac suction. Obviously, we already do this. Like, some of these things were super just what we already do. We use the giant vacuum. I call this the COVID vacuum now. So now, it used to be when I would train dentists pre-COVID, I'm like, all right, you're going to have to go find this giant elephant nose vacuum. Now I just tell people, remember that thing you got for COVID that's in the corner? Now pull it back out. You're going to use that when you do mercury. So you just put it right at their chin, and it's just going to suck the vapors that way instead of up. And then I just wear a different mask. So I used to start with like the crazy talk masks with like the big things on the side, and you walk in and patients are like, oh my gosh, like, what bomb just dropped, No,
Yeah.
no bombs just dropped. No worries here. No, so now we have one that's a little lower profile. It just goes over a regular mask. It's just kind of like a fabric filtration mask. And I wear that. And that's all I did to start with.
I want to say two things. And, one of the things, as you know, the inventor of Talking Nachos, I don't know if you've been on a show named after an appetizer, but today's the day for you. Not
so
everything
excited.
that all guests share, I understand, believe in, but I love that they're sharing them. Some things I'll share just from my personal brain is, we make such a big deal about how we remove amalgam and, all the separators, and just I might not understand all of the science, but it does seem not consistent that like this stuff could never go into our water, but no problem just keeping it, putting it in teeth. And now, as we move forward through this, putting aside amalgam and the mercury, we just have some great alternatives to not using it as much. Have you, and maybe this is a positive thing, when did you graduate from dental school? I was 2002.
97. So I'm old.
We're in the same, but like we seem to be not drilling out as many old amalgams. We're definitely removing teeth with amalgam. So maybe there's some danger there. Is this, as you progress, are we, just because we're not placing as many new amalgams, are you removing fewer? Tell us a little bit about that.
Yes, we're definitely removing fewer. However, we are now in a niche that talks about health. And so people are listening and hearing things wherever, social media, online, about how mercury fillings could be dangerous to their health. I don't tell them that. I still don't tell them that. But they're coming in saying, I want these fillings out. And interestingly enough, they've gone to other dentists that have told them no. They've gone to other dentists that say, no, they're just fine. Just leave them in. Well, in my mind, I'm thinking that's kind of patient sovereignty, isn't it? Like, if they're asking, you don't have to agree with them that, that's causing your MS, or, whatever they're saying, you don't have to agree with them. They're asking you to perform a procedure. And I often will tell people, I'll say, listen, those fillings are cracking the heck out of your teeth. So not only do I actually worry that it's, not super awesome for you or me to have that mercury around us, but it's really damaging your tooth. And no dentist can argue with us on that one. That is absolute truth. So
I agree with you. I mean, we don't offer, I do all these polls on dental nachos, who still offers amalgam in their practice, and it's just shrinking, because trying to do an amalgam, even putting the safety issues totally aside for a second, it's a very annoying material to work with. You got to get titrators, you have special things. So it is not on the menu. It's not on the menu. And then for these dentists, Michelle, they always say this, dentists are very weird, right? they love studies and they love data, but then they always tell this story, right? And they go, what about the patient who's 90 who has a 15 buckle underneath the gum line and you can't isolate it? Well, maybe they should remove that tooth, right? Maybe we
Take
don't
it
need
out.
to heroically jam any material there. So now back to your daily life. You figure out ways to manage this in your practice. Now, what are you doing with either teaching other dentists or consulting? And you're friends with one of my favorite people, Alistair McDonald. He is a normal person, not a dentist, but that's how we got connected. So tell us a little more about your life with training other dentists or coaching or consulting.
Yeah, so it's interesting. When I started transitioning the practice, first it was a mercury. Like that was the big thing. Let's take care of mercury. And then doctors started saying, well, do you also do ozone? Like, I don't have a clue what ozone is. All I know is like the hairspray I used in the
Yeah.
80s probably killed it.
Yeah.
That's all I know about it, ozone. So then I'd have to go learn about ozone because the doctors were asking me. And then I learn and go, oh, wow, why are we not using this? This is like super cool. Let's use ozone too. So I'd start using that. So the practice was really changing. And I realized that I could do a better job. Like I could do a better job of my dentistry with some of these other procedures that were really thinking about somebody's health. So I started changing and I started changing my life personally. And I was like, let's just bring it all together. Let's like make it all happy family. So I started something called Living Well with Dr. Michelle, which it rhymes. So of course I
Yeah, I
like
like
that.
that.
But there's no appetizer in my name, unfortunately. I really no appetizer, but it rhymes. So I started that where I started talking about nutrition and gardening and cooking and health and all these things. And all of a sudden, dentists that were co-minded, similarly minded, they were kind of all about health too. They were the crazy ones that, liked to eat healthily,
Yeah.
imagine they'd start reaching out saying, hey, I see what you're doing. What are you doing? Tell me
Yeah.
about it. So I didn't, again, get into teaching dentists because I actually just wanted to teach dentists. I didn't wake up thinking, gosh, I would love to teach dentists.
Yeah.
They started reaching out saying, I see you're doing it. I see you're doing it well. I see you're growing. I see all these things. Can you like give me a leg up here? Teach me what you're
I like
doing.
that.
So I started creating these modules, online videos. COVID exponentialized this because like nobody wanted to go anywhere. We all stayed home. So we all stayed home and created some of this information. Now I have a residency that people can take, a mini residency that can learn about health-based dentistry, as well as a support program where we have marketing. We have a marketing arm and a management arm that go together and a team training arm. So we have a membership that you can go through as well. So that's
Very
really
cool. I always like to, if people want to learn more about that, where can they go to learn more about that?
Yep. So go livingwellwithdrmichelle.com and there's a professionals tab on there. So it's the courses, but it's also my products. So I've also created hydroxyapatite tooth products and you can go and wholesale them there. So you can buy them wholesale, sell them retail in your practice.
And I always like to use this time for, my goal with Dental Nachos and Dentist Job Connect is to bring all these interesting ideas to dentists inside and outside of their operatory. So recently, Michelle, there's a 31-year-old dentist who sold his practice after 6 years of owning it and is able to retire because of what his investment in real estate, right? So I love that story and I think it's a cool story, and that's not my story. And I tell every dentist to explore everything with their eyes wide open because they're adults, but don't shut your mind to learning about new things. I say JFO, just find out. Maybe it's real estate, maybe it's this. But back to your discussion. So if I was talking with this dentist about real estate and he would say, I've done X, Y, or Z, but maybe this is too much, right? I wouldn't go from not owning anything to buying a strip mall tomorrow because that's too much, right? Even though I've done this, tell me maybe where some of this either becomes too much, becomes problematic. You've seen people maybe become too obsessed. Is there any watch out factors? I'm actually just totally curious.
Yeah, for sure. In fact, that's why I call myself a health-based dentist, why I made that term up, because I started calling myself a holistic dentist. Tell me what you think about when I say holistic.
I really think, if you want me to, I'll be honest on my own show,
honest,
someone who's trying to
I
scam patients, scam other people, make that, everything we do is bad in dentistry, pretty aggressive in how they talk down about everyday dentistry. So that's my thought process. I myself, interesting, I did actually take a little holistic dentistry elective in dental school back in the day, over 20 years ago. There
was one?
Yeah, taught by one of my instructors. Yeah. So that was my only foray into it. But yes, that if you want me to be honest on my own show, I would think it's not that I don't think too highly of it. My team member said this the other day. I don't know if it's a professional term or not, but they're like a wackadoodle, right? Like maybe they're over here in wackadoodle land. And then I
Yep.
hear about the specials and the shows. So that's me. I'm being honest. So
That's exactly right. And that's what everybody's term was, or version of it. And that's what I thought too. You know what I mean? That's what I thought. And also you add on to that, wearing tie-dye, having beads hanging in your doorways, burning a little incense, and nothing scientific, right? Nothing's
yeah,
based on scientific evidence. You're just doing all this anecdotal stuff. That's exactly what holistic meant in my mind as well. And that's what holistic meant in your mind and a lot of
yeah,
other dentists' minds. And that's not what we do, like, at all. We take everything that was good and is still good in dentistry, and there's so much good, and we just simply say, how is that affecting your health?
yeah.
Let's see if we can think about that a little bit. Hey, gosh, maybe you should use a different vacuum here at your chin and wear a different mask when we're removing those fillings. We're not going to put anybody else down about the way they do it. We're not going to say that anybody's wrong. And there is some talk about that. I will agree with you. There's this term that I don't like, that I actually find quite offensive inside of the holistic dental world, where they call other dentists folistic, like
Wow.
F-U-X, folistic, like
Yeah.
fake holistic. I totally do not vibe or agree with that, because I don't agree with putting anybody down. Everybody's doing their best. They're doing their best.
I love that you shared this in a way that's digestible, because one of the things I've always talked about is, my awesome mom, sadly she's not alive. She was a nutritionist in the 1980s, right? And everyone scammed us with the food pyramid. If you look at the food pyramid from the 1980s and ate that way today, you would be unhealthy. And they told everybody to have 14 servings of carbs and 1 serving of meat. And it was just
No
totally
fat.
normal. And
No fat.
yeah,
Yep.
no fat. So now we've learned, right? So I just think, one ways you could, I always say I kindly annoy dentists, right? Oh, who doesn't believe in anything holistic? I don't believe anything. Oh, do you still use amalgams? Nope, I don't, right? Well, now you're on a journey to
Yep.
maybe creating a practice where I mean, that's why I
Do you
hope,
take a supplement? Guess what?
right, exactly. Yeah, I love that.
Do you take any protein powder? Like, guess what? You are
Yes.
now
Because
this. So
dentists are into, I don't know if I'm using the term right, but I'm good friends with Mark Costas. I'm in his group, and Alice is like, they got the biohacking thread and they're doing this.
totally.
Right? And,
So that's why I use the term health-based, because it's like, okay, I don't want to turn off all these people to any of these concepts that are actually ones that they would resonate with. And I always bring this up, that would grow their practice. Because guess what? When you start arguing with your patient, telling them they're wrong, that even though you're fine with what they're saying, what are you doing? Like,
yeah,
why are you alienating a patient and making them
right.
wrong? The patient's right. It doesn't mean that you have to totally believe everything they say, but they're right. So that's why I call it health-based. So really what I'd say the biggest warning spot or place to stay away from, that I tell people too, is don't go too deep.
Yeah.
So I went to the point where I was testing everything. We were testing vitamin D in the office. We were testing HbA1c for diabetes. We were testing cortisol levels. And all of a sudden my entire front office team, their whole day was spent answering supplement questions.
Yeah, right.
And I was like, okay, we went off the deep end here. So my mantra now is, I don't test what I don't treat. So if I'm going to treat your diabetes, I'm not going to test it. If I'm not going to treat your cortisol, I'm not going to test it. I'm going to test what I'm going to treat. And there are some things that we do test that go 100% along with dentistry, with what's going to happen in our practice for you. But if I don't treat it, I don't test it. So there's a lot of holistic dentists that do a lot of different things that I don't touch, because I want my focus to be on dentistry. I'm a dentist.
I think that's a great way to look at. Remind me, what was the year that this happened, when you were sick and looking at all that? What year was that?
It was about 2010 is
2010.
when I started getting really ill. Yep.
This I always like to do towards the end of this is, so think of someone watching this or listening to this, could be now or in the future, who's like, hey, give me a treatment plan for what to do next. And you've authentically shared, hey, I got too deep into certain things. What would you say to someone who's in those shoes like you in 2010? They don't necessarily have to be dealing with a health crisis, but starting to think about, hey, would you tell them to go to this conference? They obviously can check out your website, but give me a little mini treatment plan for someone like that.
Yep. So the first place you're going to start is safe mercury removal, because you're already doing 85% of it.
Gotcha.
It's an easy starting place. pull out your COVID vacuum, put on a special mask when you're doing it, use a couple coverings in the operatory, and you're done. So you can go check out the IAOMT or my residency as well. It's going to walk you through how to do that. Next thing, ozone. Ozone's super cool. Ozone keeps your water lines clean, so you don't have to worry about spraying anyone with COVID or whatever bug's going to come along next. It is wonderful for disinfecting pockets, for desensitizing teeth. Like, there's so many awesome, cool things it does. Just go check it out. Again, I have an ozone course. So there's other people who have ozone courses. You could implement ozone for like $1,500 in your office. Like, it's super cheap. And then you just talk to people about, hey, yeah, we do ozone. If they asked you to do ozone, you can say, yeah, we do. Absolutely, we do it.
I want to ask you this. You're doing a great thing, but I just thought of something while you were saying this how has this impacted your team? Has it created a little more camaraderie? Have they been excited? Did you have a team member who wasn't on board in 2012? Because, if I went into my dental office, I mean, this happened to the olden days dentists. Like, my dad was on the news for bonding a tooth, right? He actually was cool. They came in, it was the 80s. I was so proud of him. So it was a big deal when people first started using composite. And every dental assistant wasn't like, cool. The patient said, does this white filling work? So tell me a little bit as we get towards the end, how has this impacted your team, whether it's how they feel, whether it's how they talk to patients, because we haven't talked about them yet.
Yeah, the team actually, I think, feels like they work in a really cool place because we do get attention. I have a pretty large social following. We have people coming from all over the world to come and see us. They think it's pretty cool when we have a patient that's flown in from Finland, whatever, and, to come and see us. And so it's really almost a little bit of a bragging point that they work for practice. Do you know what I mean? So I
think it's great. I mean, it's good to be proud of what you do. And I think, because your team has to be on board with any change that you make in your practice. Totally. We went out of network with insurance 2 years ago. They were the ones that got the tough questions, right? So, and I mean, I just think it's cool how you come at this in a place of, what I've gotten to is being realistic, right? You didn't come on and say, hey, everybody, throw everything in your dental office away tomorrow and go by this. But then you also said, hey, you're doing some of this stuff already, and you want to protect yourself and your team. And the thing I forgot was, it's like the whole thing with the x-ray, you run out of the room and say that it's safe to the patient, right? And I know now they tell people you don't even need the lead aprons and stuff like that, whether or not it's ever going to happen, because it makes people feel secure. But I just think it's funny. We do things to patients where we're like, hey, get these x-rays, we're going to leave the room. And then with amalgams, it's like you have to buy separators and special things. So I really appreciate
eat fish. Or not eat fish, or worry about it in vaccines or whatever. Like, everybody talks about it there. Well, actually, did you know that your mouth was full of it? Interesting.
So in our last couple of minutes, I just want to say, I really admire what you've built outside of your clinical life. Obviously, I've done this with Dental Nachos, Dentist Job Connect. It's hard to build stuff from your ideas, right? So if somebody was watching this saying, hey, I have an idea, I want to share my voice, I love to coach dentists, tell us just a few minutes about that road, whether, either with Alistair, has he helped you, your business coaches, how do you find the time for it? Whether somebody wants to start a ergonomic company for dentists or help dentists with crypto investing, tell us a little bit about that part of your life.
I've always had coaches. I mean, I've just always had a coach, a consultant, somebody. So I have I have two coaches currently. Alistair is one of them. He's the one that really helps me with business entities and knowing how that should work. Also keeps me very much on track. I think sometimes entrepreneurial types, like, I don't know about you, but I wake up with like 50 new ideas every day. Then I get tired, and then I only have 49 left because, I'm too tired to think of all 50. Yeah. But I have to have people that keep me on track.
For sure.
In the bounds of where I should be going. So I have another coach. Her name's Karen Ross, and look her up. She actually works with a lot of dentists. Cool. But she does something called In Your Own Voice, where she helps you figure out what you really do want to do. Like, what is your life track? Where are you tracking? And then she backs you all the way up to step number 1 and says, this is step number 1. Let's focus there, but always making sure that we're heading in the same direction, heading in the right direction. And honestly, I just got off the phone with her right before I got on here with you. And she, shepherded me right to where I needed to go for the day again. And she is absolutely instrumental in my life. And she will challenge me. She'll say things like, why do you want to teach dentists?
Yeah, you need those people to challenge you from outside of your box. And I'm a very big fan of this comedian, Nate Bargatze. And he has a very funny bit where he says, I'm the dreamer and my wife is the realist. And these realist people, they're so annoying and all they care about is money and they don't love fun. But he says the punchline is, you can't have two dreamers in a relationship. You'll be homeless in an hour. And I
Yep.
just think entrepreneurs, I'm the same way. Ideas, let's run this way. And you need the Alistairs and the Karens in your life to keep you
Yep.
on track. Well, you've shared so much value. I just want people to know that if they ever want to be featured on Talking Nachos, they can reach out to us at dentalnachos.com. And to learn what is the best place for people to go. They just tuned in right now, Dr. Michelle, for them to learn about you.
livingwellwithdrmichelle.com. And there's a professionals tab. You can learn all about courses as well as products on there. We'd love to have you.
Awesome, Michelle. Have a great